Patient registration and visit creation is done in the registration page. To register a new patient, click New to reset this page. This is the waiting list icon. Click this to open the waiting list. This is the waiting list for visits. This is the same list that will appear in the patient page. This is the chief complaint as saved while registering this patient in the registration page. This can be changed/edited by simply typing in. This is the triaging color. Click this icon to change to none, N, green, G, yellow, Y, or red, R. Clicking this icon will show the vital signs box. These vital signs can be entered before the patient sees the doctor. Click Save to save the entered data. The vital signs box can be closed by clicking on this icon again. This white box indicates that there are no notes/remarks or packages selected for this visit. Click this box to open the notes/package box. This is the notes/package box for this visit. If you have any packages available, they will be listed here. The package can be selected here. To view the content of the package, click View after selecting the package. Notes for this visit can be entered here. Note that this note is temporary and is not saved once the visit is finalized. Notes entered here will only appear in this waiting list box. Click Enter to save the notes or to enter the package into this visit. If any notes or package is saved for this visit, this box will be in red. Doctors, staffs and agents can be assigned to this visit by clicking on this area. To assign a doctor, search for the doctor here and select from the drop-down list. Staff can also be searched and assigned. If you have any agents saved, they can be searched and assigned as well. Agents are third parties that may receive commissions, refer managing sales agents. Click Save to save the assigned doctor, staff and agent. Clicking the patient name will bring to the patient page. If all clinics is ticked, whenever search for patient is done, it will search from these connected clinics/branches as well. Unticking this will only search from this clinic and not the branches. The connected clinics/branches can be listed by clicking here. By default, all clinics are ticked. When name or ID is searched, all the clinics ticked here will be searched as well. If necessary, you can specify the clinics to be searched. Click this icon to close this clinic listing box. This number indicates the number of appointments for the day. Click to list the appointments. This is the day's appointment list. You can register this patient by clicking on the name. Patients can also be registered from the appointments page. In this example, this is the appointment for the day. Click R to select this patient into the registration page. The patient with the appointment will be automatically selected in the registration page. To create a visit, click Create Visit Now. For new patients, once all the patient details have been entered, click Register to register the patient details. Visits can only be created for registered patients. Patient's full name with proper capitalization is required as this will be printed on receipts, reports and on any printouts. Existing patients can be searched by name here. Patient's identification, IC/passport number, is required as well. Existing patients can be searched by ID here. Important, avoid using space, dash or special characters for the ID. Existing patients can also be searched with their full telephone numbers. Existing patients can also be searched with their full email addresses. If Check Visit Token Reminder is shown, it means the HR portal must be checked for a valid visit token issued by the panel. The visit can only be billed under panel if valid visit token is available. To check for valid visit token, click Panel Portal to open the HR Portal box. This indicates a visit token, number 41 that is valid till 1st of July 2020, has been issued for this patient. Click on this to see details. These are the details of the visit token. Clicking on this name will fill up the registration page. This indicates that a visit token has been tagged to this visit that will be created when Create Visit Now is clicked. This box shows the registration number, RN, agent name, if assigned previously, and any dues. This is the registration number, RN. This is the agent name, if assigned previously. These are the dues, unpaid bills from previous visits. It is important to collect the previous dues as soon as possible. If the patient is paying this due, click on the due to record the payment. Enter the payment details here. And click Enter to save this payment. For all patients, it is good practice to record the chief complaint here. This chief complaint will be shown in the waiting list and can be helpful to the doctor. If patient refuses to tell the chief complaint or not applicable, enter NA here. Do not leave blank. This is the triaging color. Click this icon to change to none, N, green, G, yellow, Y, or red, R. Click again to change to red. Click again to change. If this is ticked, and when SMS is available, patient will receive a SMS with link to pre-consultation form containing relevant questionnaires and DAS21 screening. Patients that registered via Facebook Messenger will receive this link in Messenger. When a patient is selected, no editing is possible. To start editing, tick Edit first. When mouse pointer is hovered on the DOB field, this box will be shown. Patient's age in years or months can be entered here and the date of birth will be automatically filled up. The date of birth can also be selected from this calendar. Click the DOB field to show this calendar. Enter the patient's address here. Do not include the state and postcode here. The state can be entered here. The postcode can be entered here. When proper address has been entered, it is possible to show the map of this address by clicking Map. This is the map of the address. The patient's sex is a required field. Every visit can be grouped into the predefined groups. The predefined groups are managed in Add/Edit Patient Groups in the admin page. The groups are managed here. The patient's race is a required field. Every visit can be tagged to a referral source. This is not health-related referral but where the patient come from/heard about the clinic. The referral sources are managed in Add/Edit Referral Sources in the admin page. The referral sources are managed here. Up to 3 phone numbers can be saved. The most important phone number is the first number as this will be used for SMS. If the patient does not want SMS messages, click here to disable SMS for this patient. No SMS means the SMS has been disabled for this patient. To enable, click again on No SMS. Up to 3 fax numbers can be saved. Up to 3 emails can be saved. Up to 3 emergency contacts can be saved. Enter their names here. Enter the respective emergency contacts' contact numbers here. Enter the respective emergency contacts' relationships here. For every visit, if the patient is to be billed under a panel, the panel must be specified here. Search the panel here. And select from the drop-down list. If categories have been specified for this panel, it can be selected here. Categories are only used for panels. If there are limits specified for the panel or category, they will be displayed here. Click here to display this panel's coverage limits, if saved in the panel page. These are the coverage details for the panel. This panel can be removed by double-clicking on this field. The patient's workplace can be specified here. If predefined workplaces were saved for this panel, the workplace must be selected from this list and cannot be typed in. Predefined workplaces for this panel is saved in the panel page. For TPAs especially, workplaces should be correctly specified. Specify the patient's occupation here. If there are any notes/remark for this visit, it can be entered here. These notes can be configured to appear on panel invoices under Remark. Enter the employee ID here. This can be configured to appear on panel invoices under Remark. The employee ID will appear on panel invoice under Remark if invoice feature 3 is selected for the panel in the panel page. The notes will appear on panel invoice under Remark if invoice feature 4 is selected for the panel. This is the Remarks section in the panel invoice. If specific times have been saved for this panel, the patient cannot be billed under this panel as the visit time is not within the saved times. The coverage times for the panel is specified here in the panel page. Here the linked patients will be listed. Patients can be linked to one another with defined relationships, e.g. family members. To link another patient to this patient, click Add Link. Search the other patient to be linked here. And select from this drop-down list. Specify the relationship to this patient. Click Save/Update Link to save this link. Now this patient is linked to the current patient. If the linked patient is under a panel, the current patient can be tagged to the linked patient by clicking Tag. Tagging to another patient can be useful to generate panel invoices that are billed to a single person, e.g. spouse tagged to husband. Refer Tagging dependent to panel patient for more details on tagging panel patients. Patient links can be removed in the Patients page by clicking More Details and clicking this icon to remove the link. Up to 8 allergies can be saved in this registration page for the patient. However, it is strongly recommended for the doctor to review these entries in the patient page as more details need to be added for the allergies. Search for the drugs here and select from this list. If the drug/substance is not found in this list, it can be manually typed in. Whenever allergies are added, the doctor should review them in the patient page by clicking this icon. And add the following details to the allergies. To save the additional details, click Add. Patient's image will be displayed here. If MyCod Reader is used, the image from the MyCod will be automatically inserted here. In the patient page, the patient's image will be displayed when more details is clicked. Patient's image will be displayed here. Clicking MyCod image will load the patient's image from MyCod that is connected to the MyCod Reader. This is hardly necessary as when the data is read from MyCod, the image is automatically saved. To upload a new image of the patient, click Local Image. If Intel SysAssist app is used, the photo can be sent from the app to Media Pool and can be selected from there by clicking Media. The image file can also be selected from the computer. Once the image has been selected, click Upload to save the image. When PDPA appears in red, it means no PDPA consent has been saved. If Intel SysAssist app is used, the digital signature can be obtained and will be automatically saved here. Otherwise, to save a scanned PDPA consent, click Upload. Select the scanned consent file and click Upload to save. When PDPA consent is saved, these will no longer appear in red. To delete the existing PDPA consent file, click Delete. This is the list of previous visits VNs. Clicking the VN will bring you to the patient page. Hovering the mouse pointer on the VNs will show the date/time and notes for that visit. Merge RNs is to merge multiple patients into a single patient. It is not advisable to merge records. Patient registry will bring you to the patient's registry. Once the patient has been registered, or searched and selected, click Create Visit Now to create a visit. QMS display will bring you to the QMS interface. Do not click this, as going to the QMS display page can disrupt the queue calling. After a visit is created, click QMS queue to assign a queue number to the patient. This page will list all the active visits. Click on the required queue series, Q1 Q10, here and the queue slip can be printed. Patients can be directly messaged via SMS. Click SMS to show the SMS box. To send SMS, enter the message and click Send. Note that SMS function requires additional purchase of SMS credits. Click SMS again to close the SMS box. Clicking the Portal tab will open the Patient Portal activation box. For patients that are interested to get their records in the Patient Portal, the access can be activated here by clicking Register. Click Portal again to close this Patient Portal activation box. Time slips and quarantine memos can be issued/printed without creating a visit. Click Memo to open the memo box. Click here to select either time slip or quarantine. Enter the required details and click Print. This quarantine memo is automatically saved when printed. The saved memos will be listed here. To reprint, click this and click Print. Do not re-enter the details for the same memo. To print time slips, change the selection here. Enter the required data and click Print. This time slip is automatically saved when printed. To issue a new time slip/quarantine memo, click New to empty the fields. Click Memo to close this box. Every patient can have their own set of non-clinical notes. Click Non-clinical Notes to open the box. Enter the notes here. And click End to save the non-clinical notes. Saved notes will be listed here. To delete a note, double-click the note box. Deleted note will appear in semi-transparent gray box. Clicking on this box will show the details. Non-clinical notes cannot be permanently deleted. Click Non-clinical Notes to close this box. The same Non-clinical Notes tab is also available in the patient page. When searched by name or ID, this darker blue box will list patients from this clinic, while the lighter blue box lists patients from the connected clinics/branches. If the same patient is listed in this clinic and connected clinics/branches, always select from this clinic. If patient is selected from the connected clinics/branches, the patient's details will be imported into this clinic. Only the demographic data is imported, not clinical data. This box shows the number of matches for this patient in the connected clinics/branches. Click this box to show details. If this patient's record is available in the connected clinics/branches, they will be listed here. Click here again to close this box. The newly created visits can always be checked by clicking the waiting list icon. Newly created visits will appear like this. Visits appearing in blue without chief complaint/triage boxes are visits that are reopened for editing. That's it. You're done.